Care Compass Network is a not-for-profit community organization that was created to champion new models of providing the community with higher quality care. With us now are the Chief Medical Officer, Dr. Wayne, and Executive Director, Mark. Thank you both for being here today. We appreciate it.
Sure.
Thank you.
So Mark, we're going to start with you and tell us how CCN provides people with that higher quality care.
Yeah, so we try to do a few things where we help bring the community together. What we found when we got started with the DSRIP program was that the community is so rich with so many resources, so we try to look at ways at how we can bring them together and partner so that they can coordinate the care that they deliver to the people in our community.
Yeah, now healthcare providers also partner with you, so what are healthcare providers in our area doing?
So traditionally the model of healthcare has been very reactive. You get sick, you go to the doctor, you go to the emergency room, you sit in waiting rooms. And the new model of healthcare is really a much more proactive model we call population health. So what this involves is effective collaborations between healthcare providers, community-based organizations, of which there are many in our community. Traditionally healthcare has very much been in a silo. If you've experienced going to your doctor, they really don't know what's going on elsewhere, but now we're providing electronic health records that do provide this information. They communicate with each other, so in that sense, healthcare is much more coordinated.
Yeah, absolutely. Now, if an organization wants to get involved with CCN, or even residents of the community want to reach out, how can they do that, Mark?
Yeah, they can, for start, you can go to our website, carecompassnetwork.org, and there you can find more about how to contact the office. Maybe you're an agency that hasn't been a part of our programs yet. We'd love to hear from you and get connected. Also, a huge component of our work is enabling the community. So you can start to join a panel. We want to hear the community's feedback about their engagement with healthcare and also just what it's like being a resident in the community. So there's a panel that they can join, and that's really a great way for us to hear how we can better coordinate services on their behalf.
Oh yeah, absolutely. And so the way that the community reaches out, they just tell you their experience with their own healthcare provider, or how does that work?
Yep, so we do some surveys about every 4 to 6 weeks, and we'll do different topics. We've done transportation, access to care, and we really just try to see what is happening in the community, and then we use that to go back and coordinate with some of the physicians and providers in the region and see how we can better bring all those different pieces together.
Yeah, now really quickly, how do the physicians and the healthcare providers really get involved with CCN?
So, and that's a lot of the work I do, is engaging all the healthcare providers in the area in the work that we do, because again, as I mentioned, traditionally they've just kind of seen patients in their own office and really have not been aware of the services that are available to them, and this has led to, you'll hear a lot about provider burnout, but now we're providing the services that can help them take good care of their patients. So you'll hear a lot more about things like telemedicine, behavioral health integration in primary care, care coordinators. These are all things that can help address the social determinants that affect people's health, and it makes the life of the provider much easier.
Absolutely. Well, thank you both so much for joining me today. We really appreciate it.
Thank you.
If you have any questions or want more information about the Care Compass Network, you can go online to carecompassnetwork.org. Also give them a call at 607-240-2545.